Hi there. My name is Dr. Lily. Nice to meet you. I'm going to be conducting your examination and your cleaning today. And I see we have you scheduled for some x-rays after we're done. Because you're a new patient, I'm going to be doing just a little bit of palpating around your jaw and neck. It should be done every couple of years to make sure that our tooth health isn't negatively impacting our jaw health. I'm just going to be looking for inflammation, any deformations of any kind. So I'm just going to lean in a little bit. Okay. Could you open your mouth for me? Yeah. No, it's not a problem at all. We service shark people here all the time. However, on your application, there was a little box to mark whether or not you were, and I know that you probably didn't look for it because it's illegal for most businesses. I'm just going to keep palpating here. It's illegal for most businesses to ask that question, but we usually have to schedule quite a bit more time for shark people, as you have substantially more teeth than a human does. So we're going to do what we can today, but we have plenty of time to book you in for later in the week for anything we can't get done in your appointment today. Okay? Oh, yeah, all the time. It's kind of a sneaky little box. This has happened before. Don't feel embarrassed or anything. But it does mean that we're going to be doing probably only 2 steps today. I'm going to go ahead and lean you back and get behind you, and we're just going to get right into the checking your gum line, okay? Okay. I'm just going to be right behind you here, getting into your mouth. If you are having any amount of trouble keeping your mouth open, because it can take a little while, just raise your hand and I'll give you a break, okay? No shame in that, no worries. We're going to be starting with the counting your gum spaces, that's going to take a while. And if you hear me say skip, don't be alarmed. A lot of shark people lose many of their teeth without even realizing, and it's very normal, okay? So I'm just going to be talking to my assistant, Angela, and she's going to be writing it down for me, okay? And then we'll get on to the scaling and get as much done as we can today before your next appointment, okay? Okay. If you could open wide for me. Thank you. So we've got Angela, start on the second row because I'm gonna like the first row of teeth. Yeah, perfect. Okay. 1, 2, 1. 2, 2, 3. 1, 2, 1. Skip. 1, 3, 1. 3, 2, 3. 3, 2, 4. 1, 2, 1. Skip. And skip. 2, 3, 2. 3, 2, 3. 1, 2, 1. 2, 2, 3. 2, 2, 2. Okay, we're going to move on to the second section. Are you on the right sheet? Yeah. Great white, I think. Is that a... Thank you. Yeah, sorry. I can generally tell, but it's not nice to assume. Yeah, okay. Okay. We've got 2 2, 3, 2. We've got a tooth here that looks like it's about to fall out. Not a big deal, don't worry about it, okay? But it's possible we're going to knock it out with the treatment today, so maybe call that a skip. Yeah, you've got hundreds of them, so it's fine. 2, 2, 2, 2, 1, 2, 2, 3, 3, 3, 1, 1. Okay, if you could tilt your head just a little bit for me, just that way. Okay, we're gonna get into this side here. So third section in the back end. Okay, 2, 3, 2, 2, 3, 3, 3, 2, 3, 1, 1, 2, 1, 3, 1, 4, 1, 1, skip, skip, right, yeah, 1, 1, 1, 2, 3, 2, 2, 1, 2. Okay, and in the very, very back here, on that first row, 1, 2, 1. You've got a little, yeah, just a little bit of plaque, don't worry. We'll get it right off when we get to that phase. It'll take us a little moment. Okay, 1, 2, 1. 3, 2, 3. 2, 3, 1. 2, 2, 2. 1, 2, 1. 2, 1, 3. And 1, 2, 3. Sorry, it's hard for me to not just start scraping. Okay. Switching sides. Okay, we're gonna get on that first row. Yeah. Okay. If you could give me a little jaw break. You're doing great. Okay. Yeah, I've just been, has it been okay? I've just been kind of holding it open. Awesome. No, you're doing fabulously. Okay. 2, 1, 2. 3, 2, 3. 2, 2, 1. 2, 1, 1. 3, 2, 3. 3, 1, 1. 1, 2, 1. 2, 3, 2. 3, 1, 3. Okay, I'm just gonna be pressing a little bit to pull your cheek line back, okay? Because I'm getting right into the back of that one, and it seems like you're having a little more trouble holding it open, okay? Okay. So, 2, 1, 2. 3, 3, 3. 5, 1. That one's bad. No, that's a skip. Yeah, skip and a skip on that one. Yeah, it's really bad, but it's just a missing tooth. No biggie. 2, 1, 2. 3, 3, 3. 1, 2, 1. Okay, and 2, 2, 2. Okay. Now for on the second page for that one. Yeah, thanks, Angela. This is 1, 2, 1. We've got skip. 2, 2, 2. 2, 3, 2. Another skip. 3, 1, 2. 2, 2, 2, 2. 1, 2, 1. And there. Okay. Let's go in behind. 2, 1, 2. 3, 3, 3. 3, 4, 3. Skip, skip. Okay. I'm gonna get in here. I'm just gonna push back a little bit. 2, 1, 2. 2, 2, 2. 3, 1, 3. Yeah, we're on the back of row 1. Yeah, yeah. 3, 4, 3. Skip. 2, 1, 2. 3, 3, 3. Skip. 3, 1, 3. And 2, 1, 2. Right up here. Can you give me like a little bit of a smile? No, because it'll help move your cheek away. I mean, also, wouldn't. No, I'm not like smile. You're at the dentist. 3, 1, 3. 3, 2, 3. 3, 1, 2. Skip. No. That's not a skip, is it? Okay, we've got a little bit of recession there. It's not a problem, though. Don't worry about it. This is a harder spot to get to brush, especially for sharp people. So don't worry about it. We'll get you fixed up. That's a 5, 6, 5. Okay. I mean, it could have been, we'll take a closer look at it when we do the cleaning, okay? Yeah, because it could have been a missing tooth and then just some movement. Yeah, sometimes our teeth shift. 2, 3, 2. Our teeth shift too when we lose them. So sometimes it's a little hard to tell with sharp people whether or not they lost a tooth or they didn't lose a tooth and it shifted. Or, yeah. Okay. And 2, 2, 4, 2. I'm doing the back side of the left, first row. Okay. I'm just gonna scooch your chair a little bit. Okay. You could try and do a smile for me again. Thank you. It really helps move your cheek out of the way. 2, 3, 2. Left side, back row. Yeah. Sorry, I'm not going as fast as I normally do. Okay. 1, 2, 1. 2, 3, 2. 3, 3, 2. 1, 2, 1. 2, 2, 3, 2. Skip. 3, 4, 3. 1, 2, 1. 1, 2, 3. 2, 2, 2. 1, 2, Mm-hmm. This one looks like skip on that one. Yeah, I'd ask you, but it's, you know, you can't even tell, or so I've heard. 3, 2, 3. 1, 2, 3. 3, 2, 2. 1. Okay, and I'm just going to be pulling this cheek back a little bit, okay? See it in there. 2, 3, 2. 4. 4, 3, 3. 2, 1, 2. Skip. 3, 3, 2, 3. 1, 2, 1. And 2, 2, 2. Okay, that finishes up row 1. How's your jaw doing? You need a little stretchy break? Okay. Go to the second page again. We'll be on row 2, starting with the front. Okay. Yeah. Whenever you're ready. Perfect. Okay. Starting in the front of row 2. 3, 2, 3. 1, 2, 1. 2, 1, 1. 2, 1, 1. 3, 2, 3. And 2, 1, 3. Sorry. 2, 1, 2. Yeah, I just had a moment there. 3, 2, 3. Okay. We're gonna be going this way now. Heading towards this side. I'm gonna be pulling back a little bit. It's harder to get to that second row. I noticed that you don't have the third row. Is that just a genetic thing? Interesting. Yeah, no, I've had patients like that before, but it's more uncommon. Okay. 2, 3, 2. Gotta skip. 2, 1, 3. 3, 2, 2. Gonna get in here by your cheek, okay? 2, 3, 2. 2, 3, 4. 1, 2, 1. 1, 2, 1. 1, 2, 2. 1, 3, 2. 3, 2, 3. 2, 2, 2. 3, 2, 3. 1, 2, 1. Okay. 3, 2, 3. We've got 2 skips then, and then we're going to be moving on to the furthest back. Front of the second row. Left side. 1, 2, 1. 3, 2, 3. 1, 3, 4. 2, 3, 3. 3, 2, 4. 3, 2, 2. 1, 2, 1. 1, 2, 3. 2, 2, 3. 1, 1, 3. Okay. Alright, let me scooch my chair. It's very rolly, it doesn't get me where I want. Okay. We're just going to be doing the other side now. If you could lean over just a little bit for me this way. Thank you. Okay. I'm just going to be pulling your cheek back a little bit, okay? Thanks, hon. Alright. Front of the right side. 3, 2, 3. 3, 2, 1. 1, 2, 1. 2, 2, 2. 3, 3, 4. Skip. Skip. Oh, skip. We got 3 missing there. No, it's nothing to worry about. I'm growing back too. 2, 2, 2. Yeah, that's one of the rad things about sharp teeth. You get a 3, 3, 3, 4, 2, 3, and 2, 1, 1. Yeah, we kind of get the 2 sets and then we're screwed. 3, 2, 3. Not that that should make you feel like you have an excuse not to take good care of your teeth, okay? Sometimes when we realize something can get replaced very easily, we don't take good care of it. That's still unwise, okay? 2, 2, 2. 2, 3, 2. 1, 2, 4. A skip. Yeah, I can remember a couple of them at a time. 2, 3, 2. 1, 2, 1. 2, 3, 4. Okay. And 1, 1, 3. 2, 3, 2. 2, 3, 4. 2, 2, 1. Skip. 1, 3, 2. 2, 2, 2. 2, 2, 1. 1, 3, 1. Okay. Moving on to the back side of row 2. How you doing? You need a little break? You're a real champ. We're almost done. Then I'm going to do a little bit of scaling and then we're going to have to schedule you to come back, I think, because I've got another patient coming up soon here. So, okay, back side. 1, 2, 1. Skip. 2, 2, 3. 1, 3, 3. 2, 4, 2. 2, 2, 2. 2, 1, 3. 3, 3, 2. 2, 1, 4. Just gonna pull it back here. Got some. This seems to be one of your chewing spots right here. Oh, sorry. The counting. Sorry, Angela. Oh, the scaling is my favorite part. Yeah, 2, 3, 2, 3, 4, 4. That's one of the reasons I do my own cleanings, even though I'm a doctor and I should just be doing the examinations. 2, 3, 2, 1, 2, 1. 3, 4, 2, skip, skip. 1, 2, 2. 2, 3, 1. 3, 3, 3. 3, 3, 2. 3, 1, 3. 2, 4, 2. 2, 3, 2 on that one. Okay. 1, 2, 1. Skip. 2, 2, 3. 3, 4, 2. 2, 1, 2. 2, 3, 2. 3, 2. Okay. Scooching over to the other side here. You're doing super well. Give you a little break before we start the next part. Okay, 2, 1, 3. 3, 3, 2, 3, 4, 3. 1, 2, 3. Skip. 2, 1, 3. 2, 1, 7. 2, 1, 3. Sorry, my face. 2, 4, 2. 2, 3, 3. 4, 1, 3. 2. Yeah. 2, 1, 2. 3, 3, 3. 3, 2, 4. 3, 2, 3. 1, 2, 3. 3. 3, 3, 3. 3. Oh, that's a skip, isn't it? Well, skip. Yeah, this shifts a lot on this row. 2, 1, 3. 3, 2, 3. Okay. I think that is all counted. Angela, do we have any more rows? Awesome. Okay. We are going to go ahead and get to scaling. Luckily, there was just that one spot that I noticed. Otherwise, it really looks very good. I'm just going to scrape any plaque I find off of there. We're not going to be able to do the polishing or the flossing or anything today. We'll do that on your next visit, okay? But you should be flossing on your own. Okay. So, it seems like this side, you chew on two sides of your mouth in very specific places. So I'm going to work on getting the plaque off of that. Oh, yeah. I could tell when I met you. It's pretty obvious. But we're not supposed to assume that kind of things. As soon as I saw your teeth, at that point I'm allowed to say, okay, well, we need to schedule a little more time. But we try to be very sensitive to those. And we don't actually charge the insurance much more for the extra time. Especially because the care of shark people teeth is a lot different than human teeth. Because losing some of them is not a big deal. Yeah, that one that I said I was going to loosen up, it looked like it was on its way out. It's already almost out of the way out. I'll just probably pull it when I'm in there. Well, we get sometimes species with a lot of rows of teeth. With those ones, sometimes we don't do a full exam. When you have that many teeth, it's just important to address how they're taking care of their teeth. Especially with your mouth build, the places that have the most plaque are obviously the hardest to brush. Like, it's obvious that you are that you're trying hard. Your teeth are very healthy, but these spots, especially with conventional sharp person toothbrushes, you usually have to pay more to get the good kind that are going to reach these spots, okay? And we do sell them, but I would buy them elsewhere if I were you. They're a lot less expensive. Yeah. Don't tell anyone I told you that, but right back here. I can tell you're missing it, and you're probably missing it with your floss too. Flossing can be really tough, but they make really long, like flosser sticks for short people. And you can get reusable ones, so it's not as wasteful. And yeah, you need that extra help to get in between those back teeth. But like I said, losing a couple teeth due to breaking or a little bit of deterioration is not gonna hurt you that much. And your tooth health right now, from what I can tell, you're doing enough that's gonna get you all the way to the stage without needing dentures. Wow, I can't say dentures all of a sudden. Dentures. Yeah, it seems like behind your teeth as well, especially this top row here. You need to be brushing behind them as well. Some of it is tartar, which is hard to control because that just occurs naturally from your own saliva, because your saliva has minerals in it, and those minerals then get like stuck to the backs of your teeth, where your tongue is especially, and that's really hard for you to control, which is part of the reason you come in and get that scaled off here. Do you need a break at all? Yeah. Oh yeah. No, we haven't been open since that was an issue. We've always taken shark people here, and Bula allows any like tooth care places to ask about whether or not, so that we can schedule appropriately. But we never, we weren't open during that time. Okay, I'm gonna get over on the other side here so that I can get on your right, okay? I'm gonna need you to kind of open wide and do your best to smile if you can. It can be a little tricky when you've been in here as long as you have. But yeah, let me just move my chair a touch here. It's easier if I can. No, got a little light on it, so we don't have to shine that big bright light in your face and give you those dumb sunglasses. It can be particularly difficult for shark people too, for that bright light. It can be really damaging to their eyes. Yeah, so I just have a really bright light on my little mirror here. Mostly your first row is, you seem to take better care of your first row, especially the bottom. The top's a little iffier. Like I said, I don't think you have any cavities, but the x-rays will tell. Unfortunately, we won't be able to get the x-ray machine for long enough today. We don't have a schedule opening for what we would need to take your x-rays, so. But, oh yeah, Angela took off. She's gonna get you in the system and let you know what's your availability this week. Okay, yeah, we've got an opening, and then we can do the rest of this. Get your x-rays, get your polishing. There's just one tooth I said that I was worried about. I'm looking at it now, and it doesn't look like its decay is going to spread at all. Looks like it's going to fall out before that, so I'm not that worried about it. We can pull it today or at your next appointment if you want. It's very simple. You don't need anything for it. That's one of the great things about taking care of sharp people teeth. It's honestly easier. Yeah, we'll pull it at your next appointment. Okay, there's this back row behind your fronts here. That's just tartar that I'm scraping off. Like I said, you are brushing this spot very well, but that's just from the minerals in your mouth. It's funny, the combination of a shark and human DNA makes for a very interesting mouth composition. And you don't, the problems that normal sharks have with their teeth aren't necessarily the exact same problems that shark people have with their teeth, and vice versa. So you still need to be worried about the tartar because you've got a tongue and you're salivating all the time. And tartar can eventually cause cavities, but it's not really your fault, okay? Brushing better is not necessarily going to fix that. Well, I'm honestly being a little willy-nilly about it. This light also really highlights plaque. Yeah, it's got like a black light on it, so I'll be shining it in your mouth and I'll see a spot and I'm like, oh, that's plausible. So I'm just kind of skipping around. Yeah, I'll be going over a little bit today, but that's okay because my next patient today has been with us for like 20 years. She's late to every appointment. Every time. So if they call me on the intercom, we'll have to finish up another time, but I think I'll be able to finish scaling because honestly, like I said, your brushing habits are stellar, okay? You have really good brushing habits. It's really one of the healthiest shark people mouth I've seen in a really long time, if that's not offensive to say. Like I said, totally different mouths. It's not the same as looking at a human mouth. So you take really good care, despite the fact that you have a lot of teeth, and it's really difficult to reach some of those places. Yeah, it depends on your DNA a little bit. I believe you're going to grow them back. There's evidence that you have grown some back. And some, some of my patients shed their whole row, and grow them back. It's really very fascinating. Okay, There was one more spot over here. Yeah, you can definitely, or I can definitely tell that you favor this side for certain types of food. Mostly meats and fishes. And then the other side doesn't have quite as much plaque on it, but for one spot. Well, sometimes we find ourselves favoring sides because we're having pain in one of them, and people don't even realize it, and it really sucks because if you're favoring one side and you're not taking great care of your teeth, sometimes that favored side also starts to hurt because it's got a cavity or a crack. Yeah, people really underestimate tooth health. I have a lot of patients in their late 30s, early 40s that openly tell me they regret not taking better care of their teeth as young people. Because you're not really warned, you know. No old person ever told me, hey, you're not brushing properly, you're not flossing properly, you're gonna have dentures by the time you're 50. You know, and even if they had told me that, I wouldn't really, 50 seems so far away. Really, that's a hard thing about teaching children anything, is because they lack the perspective to understand how serious it is. You can tell them, eat healthy now or you're gonna regret it later. Take care of your teeth now or you're gonna regret it later. Don't spend all of your money now or you're gonna regret it later. They don't know. They don't have that experience. They don't have the perspective to know that, yeah, they are gonna regret it later. Okay. Alright, my dear. What time is it? Yeah, I gotta get to my next appointment, but I scaled almost all of your tartar off and almost all of your plaque. We'd like to do polishing when you come back. We'd like to do some flossing just because, and you need your x-rays, but it was really nice to meet you. I'm so glad you're with our clinic, and your teeth look really fabulous. You're taking great care of them, okay? I'll see you next time when you come in next week. Okay, make sure you stop by and see Angela.